We all know there's an opioid crisis. Nearly 2 million Americans became addicted in 2018. Some chemically dependent as soon as 72 hours after taking that first pill. And after 90 days, the time when opioid painkillers should be discontinued, 75% of people who are still on them are doing so to manage the pain of withdrawal, not the original pain. We all know there's an opioid crisis. But do you know how it affects you personally? Employees on long-term painkillers take sick leave 3 times more often. They're 5 times more likely to file a workers' comp claim, not to mention more hospitalizations, emergency room visits, and disruption in family life. This is a workplace crisis, a down-the-hall crisis, a next desk over crisis. Working moms, successful sales reps, C-level execs. Opioid dependency doesn't discriminate. We all know there's a problem, but there hasn't been a real solution until now. Using predictive analytics, along with your healthcare data, OpioidRx identifies patterns of dependency within your network. We don't identify employees. We protect their privacy and your liability. What we identify are the physicians who are overprescribing those opioids. That's the key to real change. We then confidentially intervene on your behalf, working with these physicians and healthcare providers to adopt CDC best practices for prescribing opioids. Identify, correct, protect current and future plan members. And research shows that 75% of people with a chemical dependence will discontinue a prescription after a simple, brief intervention from a healthcare expert. There's no charge for running the initial report, identifying possible abuse and providers who may be overprescribing. We simply want to show you the liabilities you face. And if we do business together, we'll intervene and introduce best practices, educating your providers and your employees, making them aware of the real cost of opioid addiction and how your company is adopting new guidelines to keep them safer. Our goal is simple, and it's the same as yours. Save money, save lives.